As the girl from
All right, Seth done. According to the largest recent poll by Quinnipiac, 54% of Americans oppose the current health care bill, while just 35% support it. In addition, according to a current Rasmussen poll, 61% of Americans believe Congress should drop the health care bill and start focusing on the economy. This topic is one that will eventually affect every one of you in one way or another, either through personal experience or through a family member. American healthcare is most advanced, most sophisticated, and best in the world, but we do not want to change the healthcare. We just want to change the cost, because often the cost is too high. Today I want to examine both sides of this issue and discuss your opinions. I will look at the current bill proposed by President Obama and the Democrats, look at alternatives to that bill, and look at the downsides to both plans. First, I want to examine the current proposal. For the purposes of this speech, I've looked at President Obama's proposed blending of both the House and Senate bills. According to the Kaiser Family Foundation, the main way to expand coverage is requiring Americans to purchase government-approved health care. If they do not purchase this health care, they will face a penalty between $695 and $2,085 per year. These penalties would begin in the year 2014. Employers with more than 50 employees are required to offer coverage. If they do not offer coverage, they will face a penalty of $2,000 per full-time worker per year. The bill expands Medicaid. It offers a tax credit to small businesses who offer healthcare coverage, and also to families who purchase government-approved healthcare coverage. It doesn't offer a government plan, but it does set up a low-cost national plan, as well as an exchange where you can buy low-cost plans. It also prohibits insurance companies from denying coverage to those with pre-existing conditions. According to the Wall Street Journal, the bill will cost $871 billion over the next 10 years. This will be paid for by $315 billion in new taxes and $438 billion in cuts to Medicare and Medicaid. Now look at some of the alternatives. The Republicans propose cutting costs in several different ways. These do not require individuals to purchase insurance, do not punish insurance companies, and do not punish workers. Representative Tom Price, a former MD, has compiled a list of the proposed bills, and all of these bills have not been considered either on the House floor or in committee by the Democrats. The first is the Healthcare Choice Act. This allows an individual to buy insurance across state lines. Currently, a 25-year-old male can buy a year of coverage in Kentucky for $960, while the same plan in New Jersey costs $5,880. The Medical Justice Act seeks to reduce the cost of health care by adopting some of the same reforms that have limited civil action suits in the state of Texas. The Healthcare Choices for Seniors Act helps make Medicare a viable program by giving them the option to wait until age 70 to enroll in exchange for several tax benefits. The Healthcare Tax Deduction Act would allow individuals to deduct healthcare costs from their taxes. Currently, if you get insurance from your job, you can get that insurance tax-free. But if you purchase this insurance on yourself, you have to pay taxes on that. The America's Affordable Health Care Act of 2009 creates several health benefit plans. These plans will cover major expenses like hospital stays and surgeries, and are low-cost, family-friendly options. Finally, let's examine some of the downsides. We don't live in a perfect world, and neither plan is perfect. The Democrat plan requires Americans to buy a product they may not wish to buy. It limits choices, limits freedom, increases taxes, punishes insurance, punishes businesses, and vastly increases government control over our lives. The Republican plan leaves our healthcare options open to the open market. It doesn't cover every American, and it doesn't solve the problem of getting coverage if you have a pre-existing condition. Today we have examined positions on both sides of the aisle. The Democrats favor more of a government-controlled plan, while the Republicans want to free up the open market to reduce costs. Our current government is certainly pushing one side of the issue, but it is very obvious from recent elections and polls that this is against the will of the American people. I'd now like to discuss some of your opinions on the issue.
37 seconds.
All right. So, would you be more comfortable with the government in control of your health care?
No.
has government-controlled healthcare come to the United States for like their biggest surgeries, and the reason doctors are doctors is because they still get paid the amount of money that they get paid, and with government-controlled healthcare, I think our healthcare system would definitely decrease in value. And
Okay.
I think by socializing healthcare and having the government in charge of it, the quality will decrease for sure. Like you can see any Latin American country as an example,
Yeah.
you would have to purchase a private social care, like a private healthcare. So it would be the same because you still have to pay for it.
Have you spoke to any people in the medical field, what they felt about it?
I haven't spoken with them, but I've heard, people on TV and radio and stuff like that. And I have a pre-existing condition, so I can't get insurance, but I can if I get a job. But a lot of the coverage that I get, because it's so expensive, is just help from the government and their current programs. And it's okay, but it's a lot easier working with a business, because if you get mad at the business, they're going to try and make you happy, and the government, they just don't care because you have to work with them.
Because I haven't really looked into the topic, because in my household it's such a hostile debate about it, but my stepmom's in the medical field, and she's all for it.
Really?
So I guess, I don't think it should happen, but some people in the medical field do, so I don't exactly know what those reasons are.
A lot of people think that a lot of doctors want it because the American Medical Association is for it, but the American Medical Association only represents 17% of doctors, and there's several groups of doctors that are against it and don't want it at all. So, yeah.
Sorry, wasn't there like an option where the government just provides an option to purchase low-cost healthcare?
Yeah, that's in the current bill.
That's okay. And also, like, I don't know, I find it kind of interesting that people are so against socializing healthcare when so much of our country is socialized. Our schools are socialized, police, firemen, all the road construction that you see, that's all socialized. I mean,
Yeah.
we're
A lot of
so
that-
much in a socialized country.
A lot of that's done by the states, and I think people are more comfortable if their state is doing something than if the federal government's doing something, because you can't really get out of it if the federal government's doing something. And also, I think that's part of the reason a lot of people are against it. I mean, you go to the DMV and you wait for 3 hours, and they're rude, and you don't want your health care like that. Yeah.
I'm not sure it's correct now, but doesn't Canada have one of the best healthcare plans in the world? And they're socialized, right?
Yeah, well, I was going to save this for my policy speech, but I'll say it now. The Canadian Premier of Newfoundland, which is basically like a governor of a state here, needed some heart surgery, and he ended up having to come here, or otherwise he was going to die. So that happens a lot.
That could be anywhere though, because one of the biggest new industries is health tourism, Americans traveling to India and Thailand.
Yeah, that happens also, and a lot of that, I know someone go to Singapore, and there's even an insurance plan that will send you to Costa Rica for some major surgeries. A lot of that is because they don't have to deal with the civil action suits and insurance and stuff like that they have to buy here.
Yeah, I've actually read that now the best healthcare in the world is India, not the United States. It's India.
Yeah.
You think since the U.S. is a capitalist economy, if you socialize healthcare, it will decrease the incentive for doctors and for medicine to improve, since there's not a monetary
Yeah, absolutely.
incentive?
I was listening to a doctor tell a story, and he said that he was speaking to a group of 100 different doctors and asked them how many of them, if the bill passes, would encourage people to go into the medical field, and one doctor raised his hand. So, also it would stop innovation. I mean, a lot of the incentive to innovate, to make new drugs and new procedures, is for profit, and if you take that away, then I guess stop investing money.
And I did live in Spain, which has more of a government-provided healthcare. It was pretty nice. I mean, when I was sick, I wasn't even a citizen, and I was there illegally.